Welcome back. We're here this morning with Shawnna Rhine from the Southern 7 Health Department, and summer may have just started, but obviously it's not too early to think about those back to school vaccinations. So why are we thinking about this now?
Yeah, school just got out, right?
Right.
Well, it's a good time to start thinking about it because, the summer goes by very quickly. But there's a few things that you need to think about. One, you need to consider that paperwork changes from year to year. It changes from state to state. So you want to make sure that you have all of your shot paperwork lined out and what you need. And you can contact your school or your pediatrician or your local health department for that. The other thing is to also make sure that your child is getting the right vaccine for their age and grade level, and to make sure that your child is up to date on those vaccines if you didn't get them caught up over the last couple years. And then finally, it's making sure that those last minute delays don't happen. Appointments get canceled, rescheduled, and also to make sure that vaccine is on hand when your child gets there.
And I could imagine that with so many students heading back to school and getting those vaccinations, that there could be a chance that the vaccine might not necessarily be there when your appointment comes around. So that's why probably doing this earlier, before the whole mad rush, before the weeks before school, it's probably super important to just get it out of the way now.
Yeah, it is. And your child's not going to be any less protected when school starts as opposed to when you're doing it now. So you're exactly right. There have been times, not recently, but you get there and the vaccine's not there for whatever reason. So get those things taken care of now.
And so why is it super important for people to get their children to have those vaccinations?
Right. Well, the big thing is those viruses are still around. When we think of childhood viruses, we think of measles and mumps and chickenpox and so on. Right. But we don't hear about them very much because kids are getting vaccinated, but they're still there. Yeah. So the best thing that you can do is to talk with your child's pediatrician about what is right for your child. You may have a child with an allergy or something that you're not aware of, so talk to them about that. Talk to your local health department about that. But those vaccines are put into place to keep your child safe. They keep other children safe and family members as well.
And there are some vaccines that aren't necessarily required before heading back to school, but those are vaccines that you guys at the health department want parents to consider. What are some of those vaccines that aren't necessarily required?
Right. Well, your flu shot, your COVID-19 shots are not required for school. HPV, which is the human papilloma virus, that is also not required for school. But they are good vaccines to have because they do protect your child against viruses, and HPV actually can protect your child against cancers down the road. So talk to your pediatrician, talk to your health department, and see what's best for you.
And obviously everyone has their own opinion about certain things. How would you talk to people who are maybe on the fence about getting vaccinations just because they're nervous about putting something into their child's body that maybe they don't necessarily know? How would you talk to them about that?
Yeah. Well, first thing we want them to do is talk to a trusted source. Talk to their pediatrician, talk to their health department, find out what is best for their child and their situation. We hear a lot about vaccine hesitancy, especially over the last few years, but that's not a new concern. Since the first vaccine ever, there was concern about it. But, again, you want to look at the cost versus the benefits of vaccinating your child. And keep in mind that a lot of these viruses do cause long-term side effects. COVID is not the only one that has long-term effects. So, look at that. Also look at, just in terms of thinking about what is best for your child, that's where you want to go. Because some of these viruses are deadly. Yeah. So, yeah. Make sure you have that done.
Of course. And so for the health department, how can people go about getting their children in to get those vaccines? Is it as simple as calling and making that appointment?
Yeah, our vaccines are required by an appointment. You can get it at any one of our local public health clinics, and you don't have to necessarily live in Illinois to get those shots. But we do encourage you, if you live out of state, it's probably best to go ahead and get in touch with your local school, your local health department, because again, that paperwork can change from state to state. And it can change from year to year. So what you saw last year might not be exactly what you're seeing this year.
Well, Shawnna, thank you so much for joining us on The Breakfast Show, too, to talk about back-to-school vaccinations. Like we said, obviously, summer just started, but it's never too early to start thinking about that and making those appointments and making sure that your children are heading back to school with those vaccinations ready to go. We'll be back in just a bit.